I'd like to tell a story today, I think, about something that's very important at MSU, and that is our basic research in veterinary medicine. It is a real highlight of the institution. MSU is unique in that we have two medical schools, an allopathic and an osteopathic medical school, a college of nursing, as well as a veterinary school. The opportunities for those healthcare providers to interact is really something that I think is really emerging as a new field of One Health. We look at animals and humans as maybe human medicine we don't worry about, that we consider quite distinct from veterinary medicine. But in fact, animals suffer many of the same maladies that humans do: cancer, osteoarthritis. And so you're going to hear today some very fundamental research, which I think has great application, immediate application for animal patients, but also opportunities for translation into human medicine. So our speaker today is Dr. Valerie Johnson. She joined MSU 3 years ago from Colorado State University. She's an assistant professor in small animal critical care. And as you'll learn from her presentation, she also has a strong interest in exotic species and wildlife as well. She earned her Ph.D. in immunology from Colorado State and completed her DVM at Tufts University. While at CSU, she developed new protocols to grow mesenchymal stem cells. These are multipotent stem cells derived from bone marrow, and to apply those in a variety of contexts, and she'll describe that today. Over the past 10 years, she's been investigating the effects of these mesenchymal stem cells as a therapeutic modality for various disease processes, including multi-drug resistant infections, immune-mediated diseases, and arthritis. Her research questions seek to elucidate the mechanism by which these cells exert a therapeutic effect. She's participated in several clinical trials with dogs and exotic species for a variety of inflammatory and infectious diseases. Her current research interests include investigating the potential antiviral effects of mesenchymal stem cells and comparisons of such cells and their therapeutic effects between species. So I'd like to also congratulate her on being awarded a Career Development Award, or a K-12 award. This is a 2-year institutional award to promote collaboration between research institutions. Please welcome Dr. Valerie Johnson.
Hi there. My name is Dr. Valerie Johnson, and I really appreciate the opportunity to talk to you all about some of my research, which I'm very excited about. I could talk to you for hours, but luckily they won't let me. So here we go. There we go. If I can figure out how to work the mechanisms. So as was said, my research interests include infection and the immune system, as well as inflammatory diseases. And in particular, I wanted to know, can we better harness the immune system to fight off some of those diseases? This slide just shows you why there's a need for such a thing. So in the early 1900s, we discovered antibiotics. It was a great discovery. However, just as soon as we discovered them, the bacteria discovered a way to circumvent them. And so what you're seeing on the top slides, middle and right, are that the incidence of multi-drug resistant infections have increased dramatically over the past 20 to 30 years. And with that increase in multi-drug resistant infections, we've also seen a decline in the production of new antibiotics. Another reason why these infections can be so hard to eradicate is that oftentimes they'll go into a different state and produce a biofilm. So the middle right panel on the bottom shows an electron micrograph of a biofilm infection. And you can see that these bacteria are producing this sticky glycocalyx. And with that, they can stick onto just about any surface. On the bottom right-hand corner, you see a heart valve that has an infection in it. And you can see the patient is deceased because these infections are impossible to eradicate. So my area of interest was, how can we better help the body to eradicate these infections? Because clearly anything we're giving to them, the bacteria find a way around. The area that I have worked in is mesenchymal stem cell therapy. And what these cells are is they are adult-derived stem cells So we create them from not only bone marrow, but also fat and blood. And these cells can turn into a couple different cell types under the right conditions, bone marrow, cartilage, and fat. But they can't turn into every cell of the body like an embryonic stem cell would. And initially, we thought that by giving these cells, we'd put them in a joint and they'd turn into cartilage, but we found that that wasn't true. We found that actually they had effects on the cells of the immune system in the body, and that when we put them into an animal, they actually did various things to the immune system depending on the situation they found themselves in. So we asked the question, would they be effective in a biofilm infection, as they'd been demonstrated to show some antibacterial activity? So this mouse model that we used, we take a piece of surgical mesh and we put some bacteria on it and put it right under the skin of the mouse. They develop a little abscess. And these abscesses don't respond to any therapy at all. You can give them antibiotics all day long. So we hypothesized that if we took these cells and we put them in with some substances that made them think they were in an infected environment, that they then might be pre-activated and better able to fight these infections. So in the middle right panel on the slide, you can see two mice. The bacteria is bioluminescent. You can see it in blue. And the mouse on the left got antibiotics. The mouse on the right got activated stem cells and antibiotics. You can see that mouse has completely cleared this infection that are very difficult to clear. On the bottom left-hand corner, you see, again, two mice. The one on the left got activated stem cells, and the one on the right got resting stem cells. And the stem cells are labeled in red. So you can see a lot of them are in the lungs because that's where they first go when you inject them IV. But in the animal that got activated stem cells, you can see that there's a lot of them right around that circle, which is the area of the wound, whereas in the animals that got resting stem cells, there's not quite as many there. So we think that the reason why these stem cells worked so well is, one, they were better attracted to the area of infection. Two, they caused the immune system to better be able to take up, or white blood cells rather, to better take up these bacteria and kill them. They also changed some of the cells from an inflammatory to an anti-inflammatory or wound healing phenotype, so helped to heal the wound after, and they also directly killed the bacteria. This next slide has a little bit of graphic pictures, so prepare yourself. Next, we wanted to see if it worked in multi-drug resistant infections. And these dogs that you see on the right are dogs that came to our hospital at the end of their rope. They had infections which no antibiotic could treat. And they were enrolled in my clinical trial. And in my clinical trial, we accepted dogs who had one or more multi-drug resistant infections for which current therapeutics were not having any effect. The dog at the top actually had a bone plate which couldn't be removed. It kept getting infected and breaking open. The next step would be amputation, but he couldn't have his limb amputated, so he was facing euthanasia. We were able to clear up that wound with intravenous activated stem cells, and you can see in the bottom two panels that it was effective as well. And indeed, overall, we cleared up completely 75% of the really bad things that were presented to us, and all animals showed clinical improvement. So then we thought, if we're treating wounds and we really want the stem cells at the site of the wounds, why can't we put them right there? However, when you do that, they all kind of leak out. We tried. So our next project, and this is the subject of my K Award, is to try and develop what we call a living bandage. So this bandage would be composed of a biomaterial that is compatible with the tissues and would eventually dissolve. But in that material, we insert living stem cells. And so in there, they can sit, they can migrate out to where they need to go, but they don't just run out of the wound. Now, working with some other researchers around this campus, I discovered that many other people had similar ideas, and they've been using nanoparticles that had antibacterial activity and also oxygen-releasing activity because wounds need oxygen to heal. So our idea was, could we combine these technologies, put them together in this bandage, and then engineer a layer of skin cells over them so that the wound wouldn't be prone to reinfection and would indeed help heal. So this is still in the very early stages, but we're very excited about it. The other part of my work, as has already been mentioned, is osteoarthritis. And the reason that we think stem cells would work in osteoarthritis is because it's a very inflammatory condition. It is currently in the top 5 leading disabilities in the US today, and it has a very complex physiology that involves severe inflammation not only at the joint, but throughout the body. Currently, the only therapeutics that we have for it are listed in black, and that is physical therapy, anti-inflammatory medications, pain medications, and ultimately joint replacement. So there's no way to actually treat this disease without just treating it symptomatically. Mesenchymal stem cells are a new therapy that we propose to use to treat this disease. We first tried this in a guinea pig model of naturally occurring arthritis. They develop arthritis by 2 years of age, and we measured their ability to run on this treadmill. We found that they could run better, faster, and had increased mobility. How did we get from there to elephants and giraffes? Well, the local zoo caught wind of a trial we had done in dogs with naturally occurring arthritis, where they did very well, and said, we have this elephant. So we tried using stem cells in this elephant. This is an elephant at the zoo who had a previous injury to the knee, and in this video you can see that she is unable to even bend that knee. She swings it around and is having a really hard time getting around. The picture on the right is a thermogram showing severe inflammation in the hip and the knee. We gave this elephant stem cells. So in this video you can see 3 months after stem cell treatment, she's walking out onto exhibit, and she's bending her knee 100% of the time. Yeah, so we did end up treating her again about a year later as it started to get worse again, and she is still currently living at the Cheyenne Mountain Zoo in Colorado. The other thing that I was interested in is, does it have an effect on viral diseases? And so there's a viral disease in elephants which is highly fatal and is a big problem in zoos and in the wild, for which these animals get intensive treatment and still 50% of them die. So we looked at this viral model in cell culture and found that stem cells did indeed decrease lysis of cells in the lab. We then moved on to a clinical trial in elephants. This is an elephant who was very sick. We didn't think she was going to make it. She received 2 stem cell treatments and the standard of care, which is intensive treatment. And she also is alive and healthy today, living at Oklahoma City Zoo. I do have a smattering of other things going on, and more than I can even tell you in 8 minutes. Our other clinical trial that we have ongoing right now is looking at the effect of stem cells in pancreatitis in dogs, which is a very inflammatory condition in both dogs and humans, for whom right now you treat only with supportive care. And still, people and animals die from it. So we've only treated a couple of dogs so far, but it's going well so far, and I'll have more to report later. We also are working with a company who has developed a diagnostic test for both infection and ability of the wound to heal, and it's being used in humans, and they wanted to know, could we use it in dogs? It's a bedside test, literally looks like a COVID test, and can give you information on how to treat the wound. So that's ongoing as well. So in summary, we think that mesenchymal stem cells have a variety of applications, both in infections, viral and bacterial, and in osteoarthritis and other inflammatory diseases as well. They can be used in a variety of species, and we're currently trying to compare the action of stem cells from different species, as well as working on our living bandage and many other things. All this research doesn't happen without a lot of help, and this is just a list of some of the researchers and technical people who have helped me in this journey along the way, and a couple of lovely ladies from my lab. And with that, I will take any questions.
Dr. Johnson?
Yes.
I see in your presentation that you're working with UCLA to try it on humans. What's the time frame for this to be applicable to
Yeah,
humans?
that's a great question. So the work that I'm doing with UCLA, because this is not an FDA-approved drug for this application, it has to go through FDA approval. So right now, what we're trying to do is get it approved for compassionate care. So these are people who have multi-drug resistant infections for which there is no treatment, and they will go to hospice. And so trying it in this group of people, we've proved its safety in animals and are on the way to proving its safety in people. There have been tons of trials done. So right now we're trying to get that paperwork done, and we're hoping, within the next 6 months or so, that we'll be able to try it out in some people that don't have any other options. And from there, we can continue to give evidence to the FDA. This is a very useful and very innovative treatment, and is safe. And hopefully, I would say, these things take a lot of time, but I would say, I would hope within the next 5 years, we would be able to get this out as a treatment.
Exciting. Thank you.
Yeah, you're welcome. Any other questions?
From the board? Dr. Johnson, we thank you for your path-breaking translational research, and
Yeah.
thank you for being here this morning.
Thank you
with
for
us.
having me.
Thank you so much.